What is going on, guys? Thanks for tuning in to yet another video. My name is Anthony Pinto da Costa, and you are watching Canadian Physio Student. All right, people, so I'm back again with another video interview. As you guys know from the last video interviews, during these interviews I sit down with some clinicians to discuss certain topics in physiotherapy in hopes of providing you guys with some clinical skills that you can take with you and then subsequently apply them within your own practice. With that said, the topic of the day for this interview is pelvic floor physiotherapy, which I'll be discussing with Cassie Dionne.
Thanks for having me. Good, how are you?
Good. It's nice to see you.
I know.
Last time I saw you was, I think, back in complex health conditions,
yeah, I feel like that was what, maybe 6, 7, 8 weeks ago?
Yeah, something like that. Something like that. Maybe even longer. So nice to see you.
You too.
But anyways, I wanted to bring you on because, you know, in physio school, as you know, we don't really learn too much about pelvic floor.
True.
We only had one lecture on it.
It's crazy, isn't it?
Yeah, for sure. So I think it's good to raise awareness, and especially people who may be interested in it, they can gain a lot from this interview. So
awesome.
Thanks for coming
Glad
on.
to talk about it.
For sure. So before we get into it, do you want to just give the people a brief introduction about who you are, where you're from, education level, all that? And we can get right into it.
Sure. So as Anthony said, my name's Cassie. I graduated Queens in 2011, so I feel like I've been doing this a while now. I'm from Belleville, so not too far from Kingston, and I did my entire education at Queens. So I did 2 undergrad degrees, including Bachelor of Physical and Health Education, and then of course my Master's of Physio. And since then, postgrad courses, and I've worked at Taylor Training Physiotherapy, where we are here, since 2011, so yeah.
Awesome. Yeah. Very nice facility, by the way, too. You should see this place. So that's all good. Very extensive education you got there. So now I guess we can get into the interview questions here. And I know this first one's very broad, and especially with your knowledge base, this may be a hard one to answer. But just in a nutshell, what is pelvic floor physiotherapy?
I mean, pelvic floor physio is just another branch of physiotherapy, right? So if you really want to look at the differences, the main difference would be in the training we receive. So therapists who work in pelvic floor physio they have specialized training looking at, assessing, treating not only the muscles, joints, nerves, everything of the lumbo-pelvic region, but also of the internal muscles and structures. So that's the big difference. But other than that, it's really not too different, right? We're still looking at the general function, we're still looking at everything, but we just have specialized training to look at those muscles and how they react and kind of work with the whole body.
So treatment goals are also the same, just trying to get people back to their function.
Absolutely.
Looking at any weaknesses and deficiencies.
Yeah, looking at muscle imbalances, looking at things that they could be improving on, learning to optimize their health, be it their pelvic health or sexual health.
For sure.
A lot of times we have people come to us that don't necessarily have an issue, but they want to, prepare to have a family, or they want to do a performance sport and make sure everything's working as well as it could be.
For sure.
So, yeah,
nice.
That's the big difference.
Awesome. Okay. So now we know all that. I think it's important to tell the people, how do we go about doing this? We all know it's pelvic floor. Everyone knows what the pelvic floor is, but there's that whole component.
Does everyone know what the pelvic floor is?
Maybe not. But there's that whole how component, and people are probably wondering, what's an assessment like? So I know this varies case by case, but could you just walk me through maybe what a typical pelvic floor assessment is exactly like? I know there's sometimes like an internal component.
Absolutely.
So if you want to tell the viewers that,
sure.
that'd be awesome.
So for the most part, there's not a ton of difference with the exception of that internal component. So, I mean, we take a very thorough, like anything, thorough subjective. The history is really important with pelvic floor stuff. So, their fitness level, their activity level, their sport, pregnancies, surgeries, all that stuff. So we take all of that into consideration. We talk about what their symptoms are, past injuries and everything. So that's the one part that we all know as physios, as physio students, right? And then a lot of people might not think about this, but during the assessment, we always do the full MSK screen too, because depending on all the orthopedic stuff can really influence how the pelvic floor is functioning. So you're still looking at, how the spine is moving, how general movement is, strength, all of that stuff. Okay, so that's kind of the first part. And then we move on to the specific pelvic floor. And this is the part everyone's always wondering about, right?
Yes, exactly.
Now, like Anthony said, hopefully everybody knows what your pelvic floor is, but they're the muscles that are on the inside of your body, right? They separate the outside and the inside. And so in order to assess them, the gold standard, really you do need to have an internal assessment. And so unlike when someone goes to, say, a gynecologist or goes to the doctor, there's no crazy equipment, there's no stirrups, there's no speculum, there's none of that.
Yeah.
And it's really non-invasive and really quite straightforward, okay? So therapists do use one gloved finger to do an internal assessment. And for that, we're looking at basically the function of those muscles, right? So is there any tension points? Is there any tenderness? How are they working? Can they contract when they should be? Can they relax when they should be? What's the strength like, the endurance like, coordination, among some other things.
Yeah.
But it's really quite simple. If someone's uncomfortable with that, of course, we don't have to do that.
Yeah.
But it does provide a huge amount of information that really helps going forward. So that's kind of that piece of it. And then after that, of course, we bring everything together, explain what's going on, and then, like anything, give people some homework.
Give them some exercise, some modalities, maybe some hands-on work, things like that.
Definitely.
Perfect. All right. All right. So this isn't one that I have prepared here, but what would you say the percentages for in terms of your male patients versus your female patients?
Definitely. So pelvic floor physio, if you don't know, men and women have a pelvic floor and have issues and can have issues. But I tend to, like, definitely women tend to seek treatment more.
For sure.
In the kind of older ages, especially after any sort of issues with prostate surgery, prostate cancer, anything like that, men will start to have, you know, more potential issues, and that's when they'll tend to seek care.
For sure.
But that's not the only time. A lot of people don't think about this. I actually did, I was down at, do you guys know Athlete Performance, or it's now Exos down in Arizona? Anyway, it's a big training place for, you know, they do the combine, everything like that. And I was talking to one of the physios there, and they predominantly saw men for pelvic floor issues because of the high level athletes have mostly or often like hypertonic pelvic floor, so things you don't think about, but was influencing performance. So men definitely need pelvic floor physio too, but definitely I see women
more women. Okay,
yeah.
Perfect, as expected.
Yeah.
All right, so we'll move on to this next question here. So now that we know all that about pelvic floor, what it is, the assessment of that for physiotherapists, how do you go about becoming a pelvic floor physiotherapist? Because, you know, like I said, we don't learn about it much, so
it's true.
It seems to be more of a post-grad continuing education thing.
And that's exactly it. So it's post-grad education, and it is a rostered activity, which means you have to pass the exam, and there are certain steps you have to do and have formal education in it. But I did mine, I guess maybe like 3 or 4 years after I had graduated, 3 years after I graduated. So I had kind of that MSK background and then delved into the pelvic floor. And there's a few different organizations that do it. I personally actually went down to Houston and did it through the American Physical Therapy Association, and they had a great program. But just those post-grad courses, and then there's like manual therapy, there's different levels, there's different courses you can take it from there. But, yeah.
So you said you got into about 4 or 5 years after. Did you want just a change of pace? Or?
Well, no, not really. So I think I got into it maybe 3 or 4 years after I graduated.
Okay.
And so actually very early in my career, I had a surgeon come to me who I knew. And she said, Cass, hey, you're a good physio, you're a great physio. I want you to become a pelvic floor physio. We need more great pelvic floor physios.
Wow.
And I said to her, I really appreciate this. I love the compliment. Thank you, but I respectfully decline. It's not what I want to do.
Yeah.
I came out of school having zero interest whatsoever. I appreciated that there was people that needed it, and that's cool, but it wasn't for me.
Yeah.
Right, and so happily I worked mostly like athletes for the first beginning of my career. That's mostly what I worked with. And then over the course of the years, I started realizing, okay, something's just not, like there's a piece of the puzzle that's missing, and something's just not adding up.
Yeah.
You would see, I mean, working in a facility with people exercising all the time, you would see women running to the washroom.
Yeah.
Okay, so check there. Yeah. But then you would see all these people who had back pain that they were doing everything you asked and you were doing everything you should be, and they just weren't getting better. And okay, something's missing. And so I started to do some research. I talked to that surgeon and just realized the missing piece was the pelvic floor. And what we didn't learn in school is how it's so related to our overall function, right? And so once I realized that, then I think 3 weeks later, I was on a plane to Houston, and here we are now.
Nice. That's awesome. That's awesome. Especially the low back component there.
There was a study. I don't know if you do pay attention to some of the more recent studies and stuff.
One thing I saw, I think it was a Cochrane review about pelvic floor physio being the first line of treatment for a span of conditions. But other than that, not too much. Okay,
so there was a study. It was done just in women. There was a study looking at women who had low back pain. Okay, so chronic low back pain. 97% of the women that had back pain had a pelvic floor dysfunction.
Wow.
Yeah.
Wow.
Crazy.
Well,
97%.
That tells you there. Okay. Very important. Okay, awesome. So we'll just we'll dive into this last question here. So I know you have, like you said, like a bigger knowledge base in this stuff than most people would because of all your continuing education, right? So there's probably a lot of misconceptions around pelvic floor physiotherapists. So do you want to just address any of those misconceptions, if there are any that you know?
Sure. I would say probably the most common misconception would be that it's, you know, pelvic floor physio is just about doing Kegels or Kegels, like most people talk about them, right?
Yeah, yeah.
And I think when you think of pelvic floor physio, you think of Kegels or Kegels.
That's what I think of, so.
Yeah, right? Because that's kind of what we've been taught to think.
Yeah,
and the truth is, that's probably the furthest from the truth. It'd be akin to saying, you know, orthopedic physio is all about clamshells and that's it, right? You can't just put one exercise and then determine that's what the whole, you know, field is about.
Sure.
And not only that, like if you're talking about it at a basic level, there are a large number of people that should never be doing Kegels, right? And so if we think that's all what it is, or there's a large number of people who maybe should but do them incorrectly. So the big misconception is that, and just not looking at everything else we do. So looking at how the pelvic floor functions with, again, with the whole body, with movement, and what strategies people have to do whatever they're doing in their life.
Yeah.
And so there's so much apart from just that direct Kegel piece.
One exercise.
Right? And it even comes down to like behavioral stuff and lifestyle stuff and simple things like how you go to the washroom.
Yeah.
Like, I mean, that sounds simple, but I remember when I did my first training, there's a list of 5 different things you have to be careful of when you go to the washroom.
Wow.
And literally every physio in the room was like, okay, I do 4 out of 5 of those, right? And not realizing those are the things that we shouldn't do.
Yeah.
And so this is the stuff that I really hope that we start to learn in school, because that's the stuff that you can literally tell any patient you talk to and they will see an improvement without ever having to necessarily ask them if they have incontinence or assess their pelvic floor, right?
Yeah, just having those little tidbits of information that you can throw out, even like for me, like somebody who's probably not going to go into pelvic floor, but who knows? Like you said, you know your whole story, but it's good to know these little things because
definitely
they could be related to whatever the patient's having. So.
Yeah, and I think another, I don't know if I would call it a misconception, but a thing we don't think about is kind of, I mentioned athletes before, but again, like our pelvic floor works with every breath we take, with every move we make. That's a song, right? But really, it comes down to it. So sometimes we see people and we see muscle imbalances and we see issues that can maybe affect performance, right? We don't think that, for lack of a better way of saying this, maybe they're leaking energy or leaking performance out of their the pelvic floor. Maybe that's something that's not helping everything fire on all cylinders. So it's a lot more than just women who have incontinence or have pain with sex, even though that's a big part of it.
Yeah, and that's definitely something that people probably don't consider, especially with performance. So that's awesome. All great information.
Yeah.
So anything else you wanted to add about the pelvic floor component of this interview, or pretty much touched on everything here?
I mean, I think we touched on a bunch. I would say the big thing, I think what we've done really great at with physio in general is coming away from that idea of like looking at things in isolations, right?
For sure.
So like way back when, if your knee hurt, it was your knee that was the issue. We didn't look at everything else. But I think when it comes to pelvic floor stuff, we kind of get sucked back into this isolation view, right? And so if there's something going on with the pelvic floor, you look at the pelvic floor, but you don't look at everything else. Or if you have a back pain, you don't think to include the pelvic floor. So I hope this starts to change, because really and truly, like we talked about, it's how you move in general and how everything works together. So
for sure.
Yeah.
Hopefully that gets through to some people out there.
If you don't, ask me questions later.
For sure,
I'll convince you.
All right, so apart from anything that we talked about pelvic floor here, I always ask this to the people I bring on.
Sure.
Do you have just any general advice for any students who want to pursue physiotherapy in this day and age? Just any general tidbits of advice?
I would say the biggest thing, and I was guilty of this, is don't try to run out of the gates after physio school and do everything. And when I graduated, I wanted to get my manual levels, get them as quickly as possible. I wanted to do the dry needling, right? Yeah. And I think that saying, what do they say? The jack of all trades, expert of none.
Yeah.
And I'm not saying don't do that stuff, but give yourself some grace and some time to hone in and really build mostly communication skills, right? Exercise prescription, and just how to talk to patients, because that's something that, again, is also changing, but we need to be skilled at that, because that will literally make or break your outcomes a lot of the time, right? And then kind of focus on your assessment skills and your treatment skills before adding all of these tools to your toolbox.
For sure.
So I think that's a big thing.
100%.
And then other than that, actually we kind of talked about this earlier, I would say find an amazing strength coach and work with them.
Yeah.
Work with them personally so you know what it's like to be coached, and so you know some of these complex kind of movements, but also they will teach you so much if you talk to a skilled strength coach, because it is a piece that we don't necessarily get as much education in.
No, strength and conditioning is super important, and they definitely got to push a little bit more of that into physio school education. So.
Just knowing about it too, right? Like, because I mean, you have someone who's a performance athlete come in, and you know they're used to pulling 700 pounds from the ground. If you give them a basic exercise, they're not gonna. They need you to understand, like the right. So those are my big things.
Awesome.
Try not to be a jack of all trades too quickly. You know, hone in your skills a little bit, and then learn from other professions, especially strength coaches.
Awesome. All great tips here.
Yeah.
All right, so. Really appreciate you coming on. That was
no
awesome.
worries. Thanks for having me.
Yeah. Did you want to leave some contact information just for anybody to reach you if they have any questions?
Yeah, so I'm basically across all social. I'm Cassie Dionne PT. So Cassie Dionne, Dionne PT. And again, Instagram, Twitter, and Facebook. So if you have any questions, shoot me a question and I'll make sure to get back to you.
Awesome. I'll throw that in the description or on the screen here somewhere so it's easy for people to find.
Click
here.
No,
for sure. Maybe I'll put it there. All right. Thanks again. Really appreciate it. So guys, if you like this video, make sure to like, share, and of course, smash that subscribe button. And I'll see you at the next video.
Another day, another dollar to be made. I'm a workaholic, ballin' hard until the grave. Used to wanna be a baller for the NBA, till the fellas around me started dunking in the 7th grade.